Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome two remarkable guests, Miriam Allred, the head of partnerships at Careswitch, and Dan Ogren, the head of design at Careswitch. Welcome. How are you?
Doing great. Thanks for having us, Lance. We appreciate the opportunity to speak with you and share a little bit more about Careswitch and about ourselves with your audience today.
You're welcome. It's our pleasure. We're excited to learn more about Careswitch. Would you both like to take a moment and just kind of introduce yourselves and give a little background in your experience and where you're coming from?
Yeah, absolutely. I'll get us started and then I'll kick it over to Dan. I'm Miriam Allred, head of partnerships at Careswitch. A little bit about me, been in the industry in home care for about 5 years. Started my journey at a company called Home Care Pulse. Most of you are probably familiar with them and the surveys, training, benchmarking report that they produce. I've got a background in marketing and sales. Came to home care kind of out of the blue, got connected with some of the executives over there. And I think like most of us here, home care kind of gets in your blood and you don't want to leave. So a couple years later, I've joined the team at Careswitch. I'm really passionate about partnerships, very deeply connected with most of the vendors, the associations, the consultants, a lot of kind of the partnership ecosystem in the industry. So very well connected and really take kind of a holistic approach to the industry, to the care. We're all in it to help the caregivers, to help the clients, to help the family members. And we on the technology side hope to do just that by way of supporting the agencies. I'm also a 2-time podcast host myself, so a little bit fun to be on the other side of the table today. Hosted the Home Care Pulse podcast Vision for home care leaders, and now currently host Home Care U, provided by Careswitch. So appreciate the opportunity to be here. Dan, I'll kick it over to you.
Awesome. Thanks, Miriam. Hey, everyone. My name is Dan Ogren. I've been in home care for about 10 years, and I'm the head of design here at Careswitch. My background is in visual design. I actually studied graphic design at the Savannah College of Art and Design in college, and I started my career at IBM when I was hired in 2013 to move to Austin, Texas, and start the new design thinking studio for IBM. I was one of the first 60 designers hired there to kind of build that studio. And I believe that studio now has about 2,000 designers here in Austin. So pretty cool experience there. After IBM, I founded a company called Rappora with 3 other co-founders. Rappora was an agency management system, what we consider a legacy agency management system now. And we ran that business from 2014 to about 2020. But during that time, Rappora was kind of struggling in terms of revenue, and we were able to kind of set it up and allow people to continue to use it. It was a very successful product from all of our customer base. People really loved it. But during that time, I moved over to a company called Frog Design, where I did some consultant work, B2B focused on fintech, oil and gas, IT services, agricultural services, a number of large scale design projects, specifically in software. And kind of did that kind of consultancy work for a few years. During that time, I met the co-founders of Careswitch. We had a lot of similar ideas. We had a lot of similar desires in the home care space. And I decided to join Careswitch in October of 2020 as the head of design to lead the product. So been there ever since. Very happy here. It's a great company, great team. So very excited about what we're working on and excited to be here today.
Wonderful. Well, we're excited to have both of you. Let's kick it off, though. We're saying Careswitch a lot, and viewers and listeners may not be familiar with Careswitch. Miriam, how would you describe what Careswitch is?
Yeah, absolutely. So I'm going to give kind of a quick background. Careswitch is an agency management software. So an AMS system in healthcare and home care, there's a lot of different terms for the software, we go with AMS, or agency management software. In a minute, Dan will talk more in depth about what that is and what that does. Quick background of Careswitch. Our founders are located in New Jersey. Our founder, Ilya Vahutinsky, his mom was an immigrant from Ukraine, and she came here, was a home health aide, kind of worked her way up the ranks, became a DON. Ilya, from his teenage years, worked inside of the business, was exposed to home care, went out, was providing care, also kind of saw the back office aspect, and very early on felt this kind of deep connection to home care. And so I want to share, kind of his story, just as a, hats off to him and for the legacy, the passion, the interest that he has in this industry. His dad is also kind of on the software side, so he was really bred to do this from both of his parents' background. And so, like Dan mentioned, Careswitch started in 2018, and we acquired their company Rappora, kind of that existing software that they had in 2020. We are venture capital backed, and so we've moved kind of hot and fast, and we've iterated a few different times. Today, our core focus is building an AI-powered agency management software. AI is not just a buzzword. Today, we're going to kind of demystify a little bit about AI. We're going to talk about what we're doing, what we're working on, how we can streamline, automate, and support these agencies with AI capabilities. We have grown quickly. We've worked with about 400 home care agencies on our first software. We were in beta this past year with our AI-powered software, and now this year we anticipate a lot of growth in the market, working primarily with private pay home care agencies. Like I mentioned, just anticipate a lot of growth, both with the product and with our user base this year. So we're really looking forward to getting back out in the market after being in beta, showing people what we're made of, and really helping agencies with their operations using AI.
Wonderful. Let's talk about the AMS, Dan, and kind of what that is and how agencies and caregivers would be utilizing that.
Yeah, so an agency management system, or an AMS as we'll refer to throughout this conversation, is really that. It's an end-to-end business management system for home care agencies. And so there's some core pillars to an AMS. If you look out in the market, there are some different flavors and varieties, but at the end of the day, they really are the engine of a home care business. And the core pillars of a product that is an AMS is really, profiles for caregivers, profiles for office staff, and profiles for care recipients, or clients as they're called by the business. Then you have a care planning element. You have the ability to create care plans, perform assessments, document the needs of the clients so that can be communicated to the caregiver. And then scheduling. Scheduling is truly at the core of the AMS, and it's all of this coordination that these agencies have to manage between their clients and their caregivers and their all the different parties that are involved in the care for a loved one or a client. So scheduling, and then from scheduling, you have shift documentation. So this is the field staffs or the caregivers going out into the home, clocking in, verifying that they're there, documenting care, and submitting the documentation back to the home care agency for review. And after the agency gets that information back into the office, they have a billing element to the product and a payroll element to the product that all bundles up into reporting. And then on top of that, there's communication and messaging. So there's all of these different elements that kind of piece together to make an AMS. But it's ultimately like kind of, when you step back and look at it, it's a very practical end-to-end workflow of data collection through care delivery, and then output of billing and payroll to kind of run the entire business. So the happy path is you onboard your clients, you onboard your caregivers, you create care plans, you schedule care. The caregivers go to the house, they clock in, document care, clock out, shift is returned to the office reviews, approves for billing and payroll, and then all of that bundles up into nice reporting for the agency to kind of track their performance as a business.
Is it used as an app, or is it telephony, or is it both?
Yeah, good question. So it's desktop and mobile app. Depends on the AMS, but specifically ours, we have a desktop and a mobile app. And the desktop is also designed to be responsive, so that if caregivers are unable to download the app or are having trouble getting into the app, they can always have a fallback solution through the web, a mobile browser as well. And in terms of telephony, we actually use GPS for our EVV, so we can check and verify that caregivers are in fact on site at the beginning and the end of each shift.
That's wonderful. How did so when did Careswitch officially roll out, you guys?
Yeah, we started in 2018. We had kind of the original version of our software, which was kind of 2018 to 2022. That was Rappora. That was kind of an evolving active product. Like I mentioned, Careswitch AI was in beta this past year, but at the start of this year, it's kind of back out in the marketplace, and we're actively selling it as a standalone product. So kind of a couple of iterations, but what we've really had a product with live users for the last 4 years.
Wonderful.
Yeah, and to add one more point to that, I think the AI version has been out since this past summer. So like Miriam's saying, we've had a number of iterations, and the AI element really kind of came onto the scene last year.
Did you guys find at Careswitch any additional hurdles or obstacles that COVID presented for the home care agencies?
Yeah, absolutely. I mean, people were definitely reaching out, asking for specific features. A lot of people wanted, questionnaires or acknowledgement in terms of when caregivers were clocking in and clocking out, acknowledging that they didn't have any symptoms prior to starting their shift. So there were a lot of features that we, quickly implemented to adapt to that scenario. But yeah, COVID definitely had an impact on these businesses because this is, face-to-face, human-to-human contact when you're providing care. So.
Well, and I don't want to jump too far ahead, but just because it's at the top of my head right now, let's say a home care agency is watching or listening to this right now, and they're using platform B, and they're like, this sounds like it might be more user friendly, more beneficial, more features. Do you have the capability to then transport or import their records from other platforms into yours to self-implement them, or how does that work?
Yeah. I can take that. Yeah, absolutely. We've got an onboarding process. We've got, data import capabilities. We've migrated people from most other softwares in the space. So we've got a process down pat. Our software is a little bit different, meaning, the way that we collect data, the way that we organize data, some of the data inputs that we have look a little bit different than some of our legacy competitors. And so there's a an automatic process, but then there is a little bit of manual entry as well, just because our system looks and feels a little bit different and has some unique benefits.
Wonderful. I want to talk about some of the more specific tasks and functions that you're using AI to help accomplish. I'm, listening, and this sounds fascinating. We have a home care company as well. And how is AI being implemented with Careswitch where it may not be being implemented in other, competitors or platforms?
Mm-hmm. We've got a lot to say on this. I'm going to zoom out first and talk kind of high level about AI, if that's okay.
Absolutely.
And then Dan's going to talk about our framework, how we approach AI, how it fits into home care, how this kind of model or framework that we've built. And then Lance, we're going to jump in and share a lot of specific examples. So know that it's intentional. I'm going to kind of zoom out, and then we're going to slowly kind of laser in. I personally have done a lot of research about AI. As we all, OpenAI came on the scene, became publicly available in early 2023. That just started kind of this resurgence for all of us in AI. And I've personally, through Careswitch, have been learning, researching, doing more due diligence on AI. And so I want to give kind of this quick timeline of the evolution of AI over the last 50 years, kind of the last 10 years, the last year. I think this has been really interesting for me, and I want to kind of share this of, we're thinking and talking a lot about AI, but it's been around for a lot longer in different forms than I even originally knew. I want to start just recommending, I've got this book actually right here. What is ChatGPT doing, and how and why does it work? Highly recommend it. Really quick, 100-page read for anyone that, as we're using AI, as we're using ChatGPT, it's like this phenomenon. It's kind of like, how does this work? What is this doing? How is this built? And this is a really quick read of, how does it work? What is it doing? What is happening on the back end for anyone to understand? And I would recommend everyone read it, because AI is a reality of modern day, of our day. And so I think to get educated about it and understand is a good place to start. But really quickly, just wanted to do kind of this quick timeline. Starting back to even 70s and 80s, this is before I was even alive. AI was like taking shape, and there was like a lot of the foundation was being built. And we think back to, kind of this like symbolic AI focused on rule-based systems, but there was a lot of limitations because of like lack of technology, lack of computational power. Fast forward to the 90s, early 2000s, internet came on the scene, big data came on the scene. There was more, technology, computational power. That's where a lot of the more complex algorithms came to be. And there was just a lot more like feasibility and possibility. Then 2010. So even, we're talking about 15 years ago, there was this era of big data, deep learning. That's where a lot of the early breakthroughs of neural networks, that's a kind of a term for people to look up if they haven't heard that, what that means, neural networks, which translated into like computer vision, natural language processing. We'll talk a little bit about that today, and speech recognition. It was about 15 years ago that, all this technology started making its way to us. Fast forward kind of mid 2010s, that's where we saw, AI beating humans at things like chess and poker. That's where we started to see it outperforming humans. And I think that's where things really started to accelerate of, can it do things as well as humans? Can it start to do things better than humans? And then kind of fast forward, the last few years, ChatGPT 3 launched in June of 2020. So that was just a couple of years ago. We saw GPT-4 launched just this past year, March 2023, and that's where OpenAI, launched something publicly, and everyone started playing with it, utilizing it. That was really just this past year. And just to kind of explain, GPT, it's like able to do this complex reasoning. It's able to, perform tasks and interpret text and images and audio and produce things with those results. And so AI is complex, but it's also kind of, you're able to dumb it down and understand what it's doing and how it works. And again, I challenge everyone to kind of do the due diligence, read into it. We shouldn't be intimidated or overwhelmed by the technology, but I think we should embrace it and look into it and understand how it works. And then that's where kind of like the beauty comes in of like, how do we use this to our benefit? How do we use it to improve our daily lives, to help us with things that we, spend too much time on, et cetera. And so it's been really interesting this past year to see what everyone is doing with this technology. There's a lot of research, there's a lot of tinkering. And I think a lot of what we're going to see into the future is just people utilizing it and learning from it. And we're going to see just more advancements and more breakthroughs to kind of bring it into the home care and the healthcare sphere. People have taken medical exams and all sorts of really complex tests with these AIs, and they're able to pass it. And so as we get into this, we're going to talk about how it could be like an assistant nurse or an RN, or it can be, this assistant that people can prompt it with questions, and it has, answers. It knows about medications, it knows about home care, it knows about, Hoyer lists, et cetera. You can ask it very specific questions, and it can give you really good, answers and depictions, and it can give you kind of first drafts of places to start. And so, this past year, a lot of people got access to OpenAI's API, meaning we could plug into their technology and start to use it, build with it, and implement it into our own technology. And so that's where we get into, how Careswitch has thought about this. How do we structure this AI in our system? How do we build with it? How do we build with it for home care? So Dan, I'll kind of turn you loose on talking more about our framework and how we're thinking about it in our software.
Yeah, that sounds good. So as we were thinking about this, last year when we started kind of, implementing GPT-4 into our product through the API, we took a step back from a design perspective, and we really wanted to ask a few questions. What are we trying to accomplish here? And what does this mean for our users, specifically in the home care space? And the first kind of big point that I want to make about our software is that part of the work we have to do when we have new customers come on board is we have to shift their mindset to understand that this is actually a different piece of technology, and the way that you interact with the software is very different from old. More specifically, meaning when you use old legacy software, it doesn't matter if it's in home care or other spaces. Typically, the software is telling the user what to do. Fill out this box, select this item, move this here, do this and that. The big mindset shift is really the user telling the software what you want it to do for you. And so that's kind of an aha moment for people when they actually start to experience speaking to a piece of software and the software behaving and performing in a way that they want to, they expect it to work. So that's the first thing, is this shift in mindset. Once you can start to kind of understand that shift in mindset where the software is truly serving you and your needs, we started to think about how do we kind of frame this internally so we can start to structure design features and build features around the home care space. And so the foundation of all of this is really data, right? The AI can only perform as well as the data and perform as well as the quality of data that you have. And so we needed to set a very strong data foundation of clean, well-organized data. So that's kind of foundationally what we've done the past few years, is just making sure that we're understanding and collecting the right data for agencies so that when we do, give it to the AI, it can actually understand it and it's not, a mess and malformed and things like that. So data is a big foundation. And then we started to develop this framework and this language around the AI. And so we thought about it in terms of what are agencies doing on a day-to-day basis that's very repetitive and mundane, and how can the AI, kind of step in and help. And the way we've phrased it is we say Careswitch AI can collect, Careswitch AI can analyze, Careswitch AI can assist, and Careswitch AI can monitor. So that's kind of what we call it's what we call our AI design patterns. And I'm going to kind of unpack each of those for you here. But specifically around the first one, collect. So agencies, as you know, a lot of agencies spend a ton of time and a lot of manpower, collecting information from their employees, the caregivers, background checks, qualifications, addresses, emergency contacts, anything that you might collect on a job application. That's a lot of information that you need to collect and get into your system, and multiply that by, hundreds of caregivers that come through your door every year, and the hundreds of caregivers that might already be on staff, right? So the first thing we identified there was how can the AI help agencies collect information, and not just for caregivers, but also for clients, right? When you get a new client, lead or referral, the beginning process here for these agencies is really just to get as much information as you possibly can, right? What are their needs? What are their problems? Why are they calling you? Where did they hear about you? How can you get all of this information kind of captured into a system and well organized so that you can always reference that and use it later to kind of build on? We always talk about this idea internally about snowballing data inside of Careswitch. So there might be a first touch with a client where, someone calls your agency, you have a quick phone call with their son or daughter. You might only get a little bit of information, but that information is that seed that kind of starts this snowball, and you have many more conversations until you've built up enough information where you can, go out and perform the assessment and then build a care plan, because all of that information is vital to providing that personalized care. So collecting information, AI helping collect information efficiently, is kind of the first pattern that we've talked about. Moving on to analyze. Agencies have all this data. Let's say they do collect all this information, which many of them have lots of data, but analyzing this data is very difficult, right? You have, again, poor data, different people entering it with different rules, and it can be very difficult to generate the types of reports you want. And, believe me, like we've talked to a lot of agencies, it seems like every agency has a slightly different way in which they want to run reports in their business, and they want to look at things just slightly different. And it can be very frustrating from a provider perspective, because you want to provide these reports, right? But it's very difficult to, create and build custom reports for every single request that an agency might want. And so with AI, the ability to analyze and simply ask a very specific question, I want you to analyze this data or look at this data and tell me this answer, or give me some summary of this information. And so that's where the AI can really step in and basically consume all the data you have and give you a very specific pointed answer. And even more interesting is that it's not just, text-based responses that the AI can provide. It can do charts, it can do graphs, they can be interactive. So we've asked, the AI to provide a map with pins on the map of where all the clients and caregivers are, and you can do that today. In addition to that, you could do pie charts or bar graphs on revenue, or overtime, things like that. And so it's kind of like anything you can come up with, or any lens you want to look at your data through, you can ask the AI to kind of provide that for you.
I want to ask
Also,
too.
before I go into the next two.
Yeah. No, go ahead, Dan.
No, go ahead. I can stop.
I think I'm going to jump in prematurely here. I was just going to ask, we're talking a lot about how this is helping agencies and the caregivers. How does it help the families that the agencies are entrusted to care for?
Yeah, absolutely. So, I mean, we're definitely B2B right now, and we do have a lot of plans to kind of involve the family more so. I guess the one thing that's most beneficial to the family that I can say we provide today is, with all this data we're collecting and the way we're collecting it, it allows for agencies to provide a very explicit, fine-tuned level of care. Because old systems of old, when you create a care plan or you try to build the tasks for a caregiver to perform in the home, a lot of times you're limited to what data sets that those agency management systems will provide. And with enter the world of AI, it's totally free-form text. And so you can write exactly what you want, and it can translate that and summarize that very cleanly in perfect English into Spanish, whatever language. But it's the level of personalization that these agencies can provide to clients and their families with AI that I think is really leveling up with AI. Okay, yeah, so the next two, I just want to move on. I can move through these pretty quick. Assist, that's our next AI pattern. A lot of agencies have manual repetitive tasks that they're doing in their office, kind of moving things around, different workflows and things like that. But one of my favorite features, this is one of my favorite things that we can do now, is the agency can basically speak into the software and tell it what to do. So for example, to create a schedule, let's say you get a new client or they've called and they're going to start service soon. You could go to your calendar and you could write MWF 8 to 5 for Sally Smith. And it will generate a Monday, Wednesday, Friday, 8 to 5 p.m. Schedule right on the calendar with a simple string of text that it's like you wrote a text to your friend. Very, very simple and straightforward. And it builds those objects in our system. And now you have real shifts on the calendar. And the next step there is to either assign or offer and find a match, right, for that shift. So, and that can all be done with, plain language. So assisting with different tasks, that's just one example that I gave, and managing schedules through commands is really, really interesting with the assist pattern. The last one here is monitor. So it's, agencies, they have a lot of information that's coming in and out, people coming and going, people calling the office, sending texts, emails, you're managing clients, you're managing their families, you're managing your employees. It's all a lot of people to stay on top of, and events are happening at all times. So the way we see AI stepping in here is really monitoring real-time activities and alerting you when things are going wrong. And you might say, well, don't other systems have alerts when things are, going wrong or flagging things when things are a little bit off within a system? And that is true. But the level of detail that we can get to with writing custom rules for yourself and for your agency. So instead of, a hard-coded rule that our system says, when a caregiver is late, we notify everyone in the office, you could write a rule that's very specific that says, whenever a caregiver is late by this amount of time in this area or this zip code, or notify these 3 people. And that's a plain text written rule. It's not because we built drop downs and inputs and checkboxes for you to fill out and configure. You just wrote that. You said, this is what I want. And now the AI knows that's the rule, and it will follow up with you if it finds something off. So I know there was a lot. Again, the 4 patterns, collect, analyze, assist, and monitor. And that's kind of how we're thinking about AI within Careswitch and in the context of home care.
No, it's fascinating. I just think, Miriam had alluded to it too. I mean, the reality is AI is here. It's not going anywhere. And I think we've not even hit the tip of the iceberg of what AI is going to be able to do to provide, support to whether it's home care companies or just society in general, really. I want to circle back real quick, Dan, on the clocking in and out. As a business owner and home care industry, as you guys perfectly well know too, it's different than being in a facility or in a hospital, where if that one caregiver who is going to take care of that one client, or maybe it's a husband and wife, maybe it's a couple, if they're not there, there's no one there at that moment to pick up the pieces and cover until somebody else can relieve them, unless it's a 24-hour shift or an overlapping shift. How does it work when, I know you kind of mentioned it, but let's say, Mary's going to go take care of Mr. Smith right now, and it's 5 minutes after the shift has started. Can you set, as an agency, do you set the parameters for when you get notified when, Mary hasn't clocked in?
Yeah, so we actually built a proof of concept. It's not live in production, but we do have a version of this. It's called our no call, no show feature. And so basically you can set the parameters when if a caregiver does not clock in. And it actually starts earlier than that. It starts with reaching out to the caregiver on the agency's behalf prior to their shift and saying, hey, are you going to make this shift that you're scheduled for in 3 hours? Hey, are you going to make this shift that you're scheduled for in 1 hour? And we keep, kind of prompting them and reaching out to make sure that they're actually going to be there. And if they do not respond, that starts to elevate, like the temperature of that potential issue, that that risk is starting to kind of increase in temperature. And so as the shift approaches and we haven't heard from the caregiver, the AI is starting to identify that, this could be a problem. If the caregiver does, say, hey, yeah, I'll be there. And this is all like texting, right? Messaging. Then, we are basically can confirm that they're going to be there. And again, we'll check again if they miss a clock in, but we want to make sure that they clock in. So we're checking that proactively on the agency's behalf. And then there's a number of steps that can occur if they don't clock in, because we know that, if someone doesn't show up, it's not just calling the client. It might be also calling the family. It's also calling the caregiver to find out where the caregiver is. Maybe they did show up, but they're not actually, just haven't pushed the button to say they clocked in yet. So there's a lot of outreach and like a chain of events that occur that can be automated through this process.
And let's say the caregiver says, yep, they confirm it, they're going to be there, and they're 1.5 miles away from the home, and they try clocking in. What happens then?
Yeah, so that's where because it's so text-based and again, messaging-based, the AI can always be gathering more and more information. So the caregiver might respond, say, I'm on my way, and the AI can be like, okay, caregiver's on the way. Tell the staff that the caregiver's on the way, but then it can follow up and say, well, how far do you think you are? And ask more questions about that. So it's always trying to, back to that AI pattern of collecting information. A lot of home care is just collecting information and passing it around. And so how can the AI be constantly proactively go out and get that information on the agency's behalf or the family's behalf, and then reporting it back to the right people?
But is there, because I know you mentioned about the GPS, which is one of the things I think is so crucial, right? Especially for people that live alone and for a lot of other reasons as well. But if they clock in and they're not within that satellite-based, area that we get, what happens if they try clocking in?
We ask them to just explain why they're not inside the fence. So we're always trying to create these audit trails of information. So if they do clock in and they're outside, GPS is great, but it's also not always perfect. It just depends on where you are. Sometimes it might say you're in the driveway, but you're actually sitting on the couch. And, so we're always trying to collect as much information as we can to kind of tell the story of the shift and what happened.
That's great. Now, you guys are, obviously this is your business. This is your day to day. So you probably might have some exciting things you're anticipating or expecting, or you might be getting ready to roll out. What are some of the future functionalities of AI that you guys are most excited about for Careswitch, if you can share that?
Yeah, let me paint in some current examples. Dan illustrated a few as he was walking through that framework. Let me kind of fill in some of the gaps of like what's possible today with the assistant, and then Dan will jump in and talk about a lot of the future things that we're working on. So that everyone's clear, inside the system, we have kind of a primary navigation like any software. On top of that sits this assistant. So at any point in time, while you're inside the software, you can access this assistant and have this conversation with it. Some of those conversations are structured, and we give you kind of a prompt or instructions to have a more kind of structured conversation with it, but it's also very freeform. You can jump in, ask it anything, anytime, and it can give you real-time responses. So there's this assistant that lives kind of on top of all of your data that it has access to. So I want to just kind of paint some more specific examples of the ways that it's usable today and some of the use cases we've seen from some of our users. A couple of things that Dan mentioned. One of the unique things that we have today is a different way of performing assessments and care plans. Like Dan mentioned, we feel there's a lot of opportunity to snowball this information. It's not uncommon for an agency to be inputting the same client details on multiple documents throughout the course of like onboarding a new client, starting with that, maybe intake, moving to the assessment, getting to the care plan that's caregiver facing. In Careswitch today, we have these assessment and care plan instructions. Every business does assessments and care plans a little bit differently. You collect different information. Maybe the state requires certain information. You can create these instructions for your assessments and care plans, and then you can have a conversation with the AI to fill out that information. Now, there's all sorts of ways that you can do this. We've seen people read in old assessments. They quite literally open up the last assessment, click on the microphone button inside the assistant, read that assessment into the system. All of the information that's collected with the AI then gets put onto the assessment document. So there's kind of this like real-time application as you're having this conversation, then it's generating the assessment document. Again, it's very free form. Our documents are kind of like rich text editors. They look more like Google Docs than like traditional checkbox forms. Going from the assessment to the care plan, there's a lot of data transfer. That's a pretty repetitive step for a lot of businesses. With Careswitch today, you can use the AI to say, take all of that assessment information, give me a first draft of a care plan. It will do that in seconds. So instead of, a nurse or a clinician, whoever in the office is conducting and doing this paperwork, they can be speeding up this process from, a couple of hours, we've heard agencies, to quite literally a couple of minutes. And it's a good way to think about it as like this first draft. It's not perfect. You want a human to fact check, you want them to review it, but it can move this information a lot faster. It can produce and generate a lot of this information a lot quicker, all the way down to the care tasks. So, for one shift, one client, there can be 20 care tasks. Let the AI read that care plan and give you some example care tasks. And then the human is always in control. They can come in, edit those, change them, tweak them, etc. And then at the end, they sign and activate that. So the whole kind of care documentation process looks very different, from the templates to then having kind of an AI conversation to generating these documents. Dan mentioned creating schedules. Today, you onboard a new client, kind of go through all that documentation, then you have to get their schedule on the calendar. It's not uncommon to have to menu dive, click, buttons, drop downs, drag and drop. That can take 10 to maybe 30 minutes. With AI, like Dan mentioned, you can just type in freeform Monday through Friday, 8 to 5, Saturdays, every other Saturday. It's very freeform. You can just tell the assistant who the client is, what their schedule is. It will go in and build that schedule, get it on the calendar. You can have it assign the caregivers. It's just a new way of thinking about scheduling. Couple of other, cool use cases. The one that I've been really blown away by is the AI, some of this more recent iterations of GPT-4, it can create PDFs and spreadsheets. It can also analyze documents, PDFs, spreadsheets. You can upload information right inside of our assistant, and then you can do things with those documents. So say you upload a spreadsheet of, all your billables last month. It then has access to that, and then you can run analysis. You can ask questions based off that data. And then the reverse of that, you can give it columns, rows, fields, and then it can produce a spreadsheet for you. So we know a lot of agencies have a lot of data documents kind of outside of their system. Now it's, we want Careswitch to be the source of truth. We want all of your data information living and breathing in one place. And the assistant makes that a lot easier to kind of house these spreadsheets, documents, analyze them, do work with them, tweak them, etc. So again, there's all sorts of capabilities with document management, document analysis. You think of creating that schedule for X client, and you want to give a PDF version of that schedule and email it to a caregiver, you can just ask the assistant, give me a quick PDF with a table of all these shifts and these dates, and assign it add signature lines. Like you can get so creative and so specific
Right.
with it, and then it can produce that PDF for you. Again, Dan kind of hit on reporting. Today we've seen a lot of legacy software that just has like endless amounts of reports that are very specific to certain businesses. And don't get me wrong, every agency, there's a lot of liberty to how you run your business, what reports you collect, what metrics, KPIs you're keeping track of. With AI, you can ask churn, revenue, shift coverage, unbilled revenue, referral source pipeline. You can just ask it, about specific metrics, and it can spit that data out to you in both text and charts and graphs. You can ask it for specific formats for it to show you these charts and graphs. So there's pros and cons. The agency
Sure.
has all this customization and liberty. We don't have to build 2,000 custom reports. It's kind of a win-win for both parties to have more accurate, up-to-date reporting in the format that they prefer.
Real quick, can you set parameters? So let's say we'll use Mary. Tell the AI, let us know when an employee has had 5 sick days in a quarter. Will it notify you automatically, almost like a reminder, or do you have to just ask it how many sick days and have it give you a report?
Yeah, so I can take that one, Miriam. That kind of falls into our AI monitor bucket, and we envision something like that in terms of that specific feature that you're asking about. That is not built yet. We don't have rules for kind of employee tracking entirely. We have some, but not to that level of specificity.
Sure.
Yeah.
Okay.
Yeah, couple other examples, if I can jump in. We are all familiar with the Rubik's Cube of scheduling and home care, matching client caregivers. How do we do that?
No idea what you're talking about, Miriam.
That's kind of one of those hot topics of how do we get better at this?
Right.
And we're seeing a lot of early signs that AI can quite literally take all of these like rich data profiles, analyze all of this information, and generate recommendations. The beauty of it is, though, it's so customizable. You can ask, a caregiver that lives within 5 miles, doesn't have allergies to pets, can lift 50 pounds. Like there's no, like Dan said, it's this different way of thinking. We're not, checking boxes. It's telling the AI, this is the client, these are the needs. Tell me, who's best suited to take this. And it can recommend 3, it can recommend 10. It's getting a lot better at processing so much information. We're working with agencies that have, 300 plus caregivers. That's a massive roster. There's so many factors, availability changes on the daily, and a human, we see these schedulers, these care coordinators that have a lot of this information living in their heads. They know some things about certain caregivers, but if we can document all of that information in depth in the software and keep that source of truth, then, turn the brain power, turn the thinking over to the AI. Tell me which 5 employees are best suited for this shift, and it can give you those matches. So again, the AI is improving every single day. The technology is the worst it'll ever be today. It's only getting better. And we really believe that some of these complex tasks, the Rubik's Cube, like the AI is going to be able to do those better than humans. And we're already seeing early signs of that. And so we want to just empower these schedulers, empower everyone in the office to have access to, this kind of pocket assistant that they can just pull up, ask it, utilize it to make their jobs easier, to make their lives simpler, and to, focus on the care. How do we get them doing less of the documentation, the paperwork, the not so fun day-to-day tasks, and let them focus on the people? So I think that recommending client and caregiver, that matching piece is so crucial. And we really do think AI is going to make some breakthroughs to improving that process.
That's incredible. What would you say the limitations are to AI for the ability to help home care agencies?
Yeah, I think I can take that one, Miriam. It's really it's a two-part answer. The first is just explicitly calling out that we're in early preview with OpenAI. So we have access to their API, but we are kind of constricted by their development, right? So they're not generally available. It's not a full production level API yet, but we are on the list. We are using it, and it's very, very exciting in terms of what it's doing. So all of our AI is labeled beta within our product. You can still run an agency with our product, but the AI elements, most of the time they're good, but sometimes you're going to get some weird answers and some hallucinations, and you just poke it again and maybe you'll get the answer you need. So as they improve, we will improve. The limitation there is just the amount of data it can consume. So Miriam talked about these examples that we're seeing that, hundreds of caregivers being, given to all their profiles, given to the AI and having it crunch through all that data and then make a decision for a specific client for this shift on Tuesday. Definitely some limitations there in terms of how much data the AI can, for lack of a better term, swallow and give you an answer back. But with smaller sets, it's performing very well. And so that as the preview gets lifted, we expect that to be kind of basically going away eventually.
Yeah.
And the next part, the other limitation is it's hard to answer that question because we actually don't know the limitations of it in a lot of ways. It's so free form and so fluid that, we're seeing, examples of our customers using it every day. We didn't know it even could do some of the things people are doing with it because there's some weird edge use case that they got into and they're trying to use the AI to get out of it. And they were able to do it. So it's just a very interesting, we don't know where the edges are of this product in terms of what it can do today. It's probably more performant than we're even describing it now. And that's what's really exciting. So I can give one example of that. The other day we were on a call with a customer and we were showing them some of the PDF exports of our assessments and care plans, and they were looking at them, and these were generated by the AI, by the way. And they were looking at them and they were saying, these look great, but we actually want signature lines on our PDFs for our assessments and our care plans. And so typically in a legacy software scenario, we would take that as feedback. We would put it in our backlog and we'd hope to get around to building it, 2 to 6 weeks maybe, and we'd put those lines on that export. But instead, right on the call, we just prompted the AI and said, hey, we love the export you made, but can you please add a signature line for the care recipient or the client and the employee? And within a few seconds, it regenerated the PDF, and there you had 2 blank signature lines labeled with the care recipient and the employee's name.
It's incredible.
At the bottom. Yeah. And so it was there, and it just didn't know that you wanted signature lines at the bottom. So just tell it, and here it is. So that's just another great example of something we didn't have to build, but also something that allows agencies to kind of get to the level of detail and tell the software what they want it to do versus waiting around for that feature to be implemented.
That's awesome. I want to, before we wrap up here, just a couple of quick questions. And first, I want to, Miriam, and we're going to have all this in our show notes and on our website, but I'd like you to call it out especially for people who might be listening and not watching. Where do you want people to go who may be interested in learning more about Careswitch or reaching out to you guys?
Yeah, short and simple, careswitch.com. Hit that site, poke around. We've got a lot of eyes on that site. A lot of people are just fascinated hearing about Careswitch. Hit that site, click around, read about some of these things that are built, that are possible. We've got some use cases on there, and just kind of start to explore what's possible on that site. I also want to direct people to Home Care U, our show. We interview some of the top guests, some of our customers. We're talking about AI. We talk to a lot of the top kind of leading thought leaders in the space about home care. That's Home Care U, and you can find that podcast wherever you get your podcasts, or you can find that on our website as well. So careswitch.com, point people there.
All right. And it's a great podcast. I've listened to quite a few of the episodes. The other question is, if I'm an agency owner and I'm using a platform right now and I might not be happy with it, or for whatever reason, or this sounds more user friendly for me and just gives me a lot more flexibility, I guess would be a better way of saying it. Is it contract based? Is it month to month? Is it based on the number of employees you have? Is that something you guys can share now, or should they just reach out for that information?
Yeah, I can give kind of a quick teaser. On our website, we've got a form, kind of a request demo form, pretty straightforward in technology. People can hit that. We just have annual contracts today, and we bill a little bit differently. It's a percentage of revenue. Again, the numbers kind of fluctuate depending on the size and shape of the agency, but we're thinking a little bit differently about how we charge people, less of the kind of per seat or per hour, and actually as a percentage of revenue. And again, annual contracts.
Okay, thank you. And one question I like to ask guests when they're on, and hopefully we'll be staying in touch, but if we didn't talk or see each other for the next 5 years, Dan and Miriam, and we ran into each other maybe at some senior care conference or, some big unveiling of Careswitch. How has AI changed? Where do you perceive Careswitch and the role AI is playing in it 5 years from now?
I'll start and then kick it over to Dan. We saw technology come onto the scene in home care just 10 or 15 years ago, not very long ago. In my kind of short lifetime, I believe in 5 years from now and in 10 years from now, AI will be as integral to home care as technology was 10 years ago. We were on pen and paper not long ago. There are still agencies today on pen and paper.
Yes, there are. Yeah.
And I believe that AI will become as integral as technology did 10 years ago. I believe every home care owner, operator will be using AI in some capacity within the next 5 years. The flip side of that coin, care will always be human. We do not believe that AI is taking people's jobs in 5 years. We believe that AI will be supplementing, assisting, helping owners, operators, administrators, staff, all the way down to the caregivers and the families. But the care will always remain human. And that's what we want. We want the people to be able to focus on the people. And we want technology to do what it does best on the back end. And so, my take is AI is here to stay. It's not a buzzword. So embrace it and adapt and utilize it and let it do the things that it does best so that the humans can focus on the care.
Wonderful.
Dan, what would you add?
I would say for me, I think my answer is a little bit weirder, but I think AI is going to be seen less as a tool in the future and more as a member of the care team. Mm-hmm. Right now, it's like, hey, I can interact with this software and tell it what to do. But I think that as it advances, it's going to step up in ways that and fill gaps on care teams and support care teams, whether it's professional or family member led teams. I think there'll be a huge part of the care team circle around different people and supporting that entire process.
That's incredible. Well, Dan and Miriam from Careswitch, thank you both so much for joining us today. I just think the work you guys are doing is incredible. I think you're on the very cutting edge of this whole AI revolution. Being from a home care industry, I just applaud the work you're doing, because anything that can help provide a higher level of care, but also reduce the amount of work in the office is always a good thing, especially if it's more efficient. So thank you both, and hopefully we'll talk again in the future.
Sounds great. Thank you so much, Lance.
Oh, it's our pleasure. Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms, or watch the show on our official YouTube channel. Just make sure that you hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to Miriam and Dan for joining us today. We look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.